Stop. Stop sharing.
షేర్ అంటే ఫస్ట్ షేర్.
డబుల్ క్లిక్ చేయాలి. షేర్ టీవీ క్లిక్ చేయాలి. మ్యూట్ చేసిన మ్యూట్ చేసిన మ్యూట్ మరో తీసుకుంటాను మ్యూట్ చేస్తే
Hello, students. Very good evening to one and all. I'm Sriveni from Department of Psychology, Dr. B.R. Ambedkar, Open University. So from 26th of May, we are listening the abnormal psychology classes of UG fourth semester. So till we have covered with Sumana ma'am, like with the block one introduction to abnormal psychology. This includes the unit's historical perspective of abnormal behavior, and second unit covered theoretical perspective of maladaptive behavior and causes of maladaptive behavior, and block two covers anxiety, personality and mood disorders and suicide. And the third, in block three also, we have covered introduction to psychotic and cognitive impairment disorders. Like unit 7, ma'am has talked about the schizophrenia and cognitive impairment disorders. So now we are going to discuss about the common therapeutic approaches to psychological disorders. Okay, students? So the coming to the introduction part. Psychotherapy indeed encompasses a wide range of approaches tailored to individuals' need and preferences. Each approach offers unique and perspective and techniques to address various psychological disorders and challenges. And the psychotherapy is described as a use of psychological methods based on regular personal interaction to help a person change behavior and overcome problems in desired ways. So the permanent therapeutic approaches such as psychoanalytic therapy, humanistic therapy, behavioral therapy, and cognitive behavior therapy. All these techniques ma'am has covered in the unit 2, therapeutical perspective in maladaptive behavior. So we are not going in depth. So briefly, psychoanalytic therapy is introduced by Freud. Human behavior is governed and directed by certain instinctual drives and biological urges, irrational forces, which are often expressed through unconscious motivations involving in the first 6 years of an individual's life through what he calls as a psychosexual stages of development. There are 5 psychosexual stages, namely like oral, anal, phallic, latency, and genital stages. And Freud argues that the development of personality and its components are based on the psychosexual development that takes place during this window of development. And the Freud's understanding of human behavior resolves around the concept of instinctual drives, which he believed govern and direct our actions. He identified two primary drives like the preservative drives, which include basic bodily functions like breathing and eating, and the species preservation drives, which is in the sexual drive. The energy associated with the sexual drive is termed as libido. And the Freud exploration of the conscious and unconscious mind indeed revolutionized psychology, offered profound insight into the human behavior and the root cause of psychological issues. His conceptualization of the unconscious as the repository of the repressed memories, desires, and conflicts. Inaccessible to the conscious awareness led to the foundation of psychoanalytic theory. And Freud recognized that while the conscious mind represents only a small portion of our mental activity, the unconscious extracts a powerful influence on our thought, feelings, and behavior. and dreams, lips of the tongue, and the other seemingly accidental actions provide glimpses into the working of the unconscious, offering valuable clues about underlying psychological dynamics. And coming to the psychoanalytical perspective of the personality structure, like he explained by id, ego, and superego. It here means this is a primal instinctual part of the personality. It operates on the pleasure principle, seeking immediate gratification of basic needs and desires. Regardless of the consequences, the id is unconscious and operates it at an irrational level. And the ego, which he explained like it develops from the id in infancy and it operates on the reality principles and mediating between the demands of the id and the constraints of the external world. The ego seeks to satisfy the id decides in a realistic and socially acceptable manner. It's the conscious part of the personality dealing with the reality and making decisions. And he explained the third point is the superego. This is a moral component of personality, incorporating societal standards and values. And it develops as a result of the child internalizing the moral standards of the parents and society. The superego aims for the perfection rather than pleasure, striving to uphold moral ideals and standards. And anxiety is a crucial concept in the psychoanalytic theory. It arises when the ego is unable to effectively manage the conflicting demands of the id and superego, and it leading to the sense of unease or apprehension. And the therapeutic goals, like the goal of psychoanalytic therapy is to help patients better understanding the unconscious forces that plays a role in the current behavior, thoughts, and emotions. And the Freud believed that people could be cured by making conscious their unconscious thought experiences, thus gaining insight. The aim is to release repressed emotions and the experience in make the unconscious a conscious. And there are a number of therapeutic techniques or strategies used in psychoanalytic or psychodynamic approach of treatment. These are like systematic use of the therapist-client relationship and identifying and resistance and defenses, free association, and he made dream analysis also and interpretation and the resistance of the client. And the shortcoming of this psychoanalytic therapy is cost and perceived values and ambiguity and lack of direction and neglect of external factors. And the next approach is humanistic therapeutic approach. Person-centered therapy developed by Carl Rogers indeed takes a markedly positive view of individuals, believing in their inherent tendency towards personal growth and self-actualization. Instead of focusing on diagnosis or prescribing specific techniques, it emphasizes creating a supportive environment where clients can explore their thoughts, feelings, and experiences freely. And the key concepts are like Rogers listed 3 therapist attributes that can create a growth promoting climate where the client can move forward and become what they are capable of becoming. First one is the congruence, means genuineness or realness. And the second one is the unconditional positive regard, that is acceptance and caring. And the third one is the accurate empathetic understanding, that is an ability to deeply grasp the subjective world of another person. And the Rogers proposes 6 necessary and sufficient conditions of therapeutic changes. These are psychological contact, incongruence, congruence, and genuineness, and unconditional positive regard and acceptance, empathy, perception of empathy, and acceptance. And the therapeutic goals are like the person-centered approach highlights both in the therapeutic goals and its limitations. The approach by Carl Rogers emphasizes the importance of fostering personal growth and self-understanding in client rather than merely solving their problems. While it has its merits, such as promoting independence and integration, and it also faces challenges, particularly in providing the structure of some clients' desires, adapting to diverse cultural contexts, and its emphasis on internal locus of control with the collectivist cultural values. And the limitations suggested that while the person-centered approach can be effective for more individuals, it may not suit everyone's needs or cultural backgrounds. It underscores the importance of therapists being flexible and culturally sensitive in their approach to make the diverse needs of their clients. And the third one we are coming to, that is behavioral therapeutic approaches. This stands out for its emphasis on the observable behavior and the application of learning principles to felt state change. Its foundations in experimental psychology underscores its systematic and structured approach to counseling. By focusing on current determinants of behavior and employing tailored treatment strategies, behavior therapy aims to empower individuals to increase their skills and broaden their options for responding to problems. And this approach has a successful applied across a spectrum of psychological disorders and client populations. And the key characteristics of behavior therapy includes a systematic application of learning principles, focuses on current problem and influencing factors, and action-oriented and educational approach, and emphasize on behavioral change over insight and consideration of cultural and social context. Tailored interventions for individual clients. These key characteristics highlights the systematic, client-centered, and empirically grounded nature of behavior therapy, making it a versatile. It means that able to use for many different purposes. This therapy can be used and effective approach in addressing a wide range of psychological issues. And the therapeutic goals of behavioral therapy is central importance in behavioral therapy. The general goals of the behavior therapy are to nurture adaptive skills and increase personal choice of option in an individual's repertoire. The aim is to reinforce desirable and eliminate unwanted or maladaptive ones. It is usually focused on increasing the person encouragement in a positive way or socially desirable activity. And the shortcomings, coming to the shortcomings of this therapy, behavior therapists can integrate culturally sensitive approach into their practice. This involves understanding the unique perspective and experience of clients from diverse backgrounds and tailoring the therapeutic techniques accordingly. Additionally, ongoing training and education in culture competence can help therapists navigate sensitive issues related to race, gender, ethnicity, sexual orientation, and other forms of diversity. And the fourth one is the cognitive behavioral therapeutic approaches. This highlights its evaluation from traditional behavior therapy and discussing key concepts and major figures like Albert Ellis, Aaron Beck, and Donald McKibben. Evolution from traditional behavior therapy, the CBT has broadened and largely moved from traditional behavior therapy towards a cognitive behavior approach, which combines cognitive and behavioral principles in the short-term treatment approach. And the key characteristics of CBT are collaborating relationship with clients and therapists, focuses on disturbances in cognitive processes as a cause of psychological distress. The emphasis on changing cognitions to produce desired change in affect and behavior. And it's a time-limited and educational treatment focusing on specific and structured target problems. And Albert Ellis' rational emotive behavior therapy, in this, human beings view having both the rational and irrational thinking tendencies and emphasizes the reciprocal relationship between cognitions, emotions, and behaviors. And it also outlines the therapeutic process of identifying and disputing irrational beliefs to replace them with rational cognitions. And Aaron Beck cognitive behavior therapy is described as focusing on how people perceive and structure their experiences with psychological problems stemming from faulty thinking, similar to REBT, and cognitive therapy aims to recognize and change negative thought and maladaptive beliefs. And the Donald McKibben Cognitive Behavior Modification CBM focuses on changing clients' self-verbalizations and emphasizes the impact of self-statement on behavior. The therapeutic process involves helping clients become aware of their self-talk and modifying their instructions to cope more effectively. And the shortcoming of CBT is its negative view of dependency, which may conflict with cultural values that prioritize interdependence. And the conclusion is, coming to the conclusion, psychotherapy encompasses a broad range of approaches aimed at helping individuals address and overcome psychological distress. It's essentially a collaborative process between the therapist and the client, where various techniques and methods are employed to explore thoughts, emotions, and behaviors. Each type of psychotherapy has its own theoretical framework and techniques tailored to address different aspects of individual experiences. And the other types of psychotherapy includes mindfulness-based approaches, dialectical behavior therapy, and acceptance and commitment therapy, and many more. The choice of psychotherapy depends on the factors such as the individual preferences, the nature of their difficulties, and the therapist's expertise. The ultimate goal is to enhance the individual's well-being and quality of life. Thank you. So now we are moving to the other lesson, that is disintegrative disorders. So disintegrative disorders is the childhood is a crucial period of development, shaping adult personality and behavioral patterns. So the childhood is also a time of vulnerability to various difficulties, which includes psychological disorders such as attention deficit hyperactive disorder, conduct disorder, childhood depression, eating, and cyber disorders, and its treatment we are going to discuss in this lesson. And the psychological disorders seen in children which can hinder personal growth and happiness. Galfand and Jensen and Drew in 1988 emphasized the importance of early intervention in preventing childhood developmental issues from evolving into more severe disorders later in life. First one in disintegrative disorders is ADHD, Attention Deficit Hyperactive Disorder. It is defined as the presence of developmentally inappropriate degrees of inattention, impulsivity, and hyperactivity. So the children are unable to sit in one place for a period of time according to their age level. They are impulsive and they are hyperactive. And the incidence of ADHD, the studies have documented at 5 to 12%, and it is more prevalent among boys than in girls. And the causes of ADHD. Causes of ADHD, the, the analysis identified both the environmental and the biological factors as potential causes of ADHD. Are like environmental factors includes unstable family environments, maternal substance abuse during pregnancy, exposure to toxins like lead and traumatic brain injury, and genetic predispositions are highlighted, with children having a family history of ADHD and being more susceptible to developing the disorders. And the symptoms of ADHD encompasses inattention, hyperactivity, and impulsivity. It emphasizes that while these behaviors are normal to some extent in all the children, they are more severe and pervasive in individuals with ADHD. And the analysis categorizes ADHD into three subtypes based on the predominant symptoms like combined type, predominantly inattentive type, and predominantly hyperactive impulsive type. And the treatment of this ADHD, treatment is like interventions for managing ADHD includes parental counseling, behavioral interventions, pharmacotherapy, psychotherapeutic interventions, and educational measures. And multidisciplinary approach tailored to the individual needs of each children with ADHD, aiming to improve innate attention, impulse control, and overall functioning in different settings. And now we are moving to the conduct disorder. Conduct disorder is a common childhood psychiatric problem that has an increased incidence in adolescence. The primary diagnostic feature of conduct disorder includes aggression, theft, vandalism, violation of rules, and lying. The children with this disorder have great difficulty following rules and behaving in a socially acceptable way. They are often viewed by other children, teachers, and parents as bad or delinquent rather than mentally ill. And they are troublesome children, more often troubled children. Diagnostic and Statistical Manual of Mental Disorders, that is, now we are using DSM-5. It is defined as an essential characteristic as a persistent pattern of behavior in which the basic rights of others or major age-appropriate social norms are violated in the society. And the causes of this conduct disorder, there is no known cause for the conduct disorder, like ADHD or any other disorder. With conduct disorder frequently leads to the blaming, labeling, and other unproductive activities. Parents of such children are often blamed as a poor disciplinarians or bad parents. Family dysfunction, poor parenting practices, and overemphasize on hostile communication patterns, verbal and physical aggression, and the history of maltreatment are the causes of this conduct disorder. And the symptoms of this conduct disorder are the children exhibit certain behaviors that causes harm to themselves or others with little guilt. And the treatment to conduct disorder, psychopharmacological intervention Sorry for the disturbance. Issue is rising. Next is eating disorder. Eating disorder encompasses eating disorder encompasses a range of wide range of characteristics by abnormal eating habits that can severely impact physical and mental eating behavior, such eating disorders. Types of eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorders are the most common specific forms of eating disorders observed in the human being. And the first one is the anorexia nervosa. Anorexia nervosa involves a self-imposed starvation due to an intense fear of gaining weight. Individuals with anorexia often perceive themselves as overweight despite of being underweight or emancipated. Anorexia typically develops during adolescence and is characterized by refusal to maintain a healthy body weight, fear of gaining weight, and distorted body images. And second one is the bulimia nervosa, which involves recurrent episodes of binge eating followed by compensatory behavior to prevent weight gain, such as self-induced vomiting and excessive exercise. And symptoms include secretive eating, frequent fluctuations in weight, and physical signs like calluses on the hands or discolored teeth. And the third one is the binge eating disorders, which involves recurrent episodes of impulsive overeating without compensatory behavior. And individuals with binge eating feels a loss of controlled during binge episodes and often experience guilt, shame, or depression afterward. Many people with binge eating are overweight or obese. And dealing with eating disorder, role of psychologist is treatment for an eating disorders includes both the physical and psychological aspects of the problem. The goal is to treat many medical and nutritional needs, promote healthy relationship with food, nutritional counseling and group support works best. In some cases, a residential treatment or hospitalization may be necessary. And the next one is the cyber disorder, a group of disorder characterized by preoccupation with the internet, increased anxiety when offline, hiding or lying about the extent of online use, and impaired to real life functioning. And this cyber disorders, the types of cyber disorders includes cyber sexual addiction, cyber relationship addiction, internet addiction, computer addiction, and cyber bullying. And cyber sexual addiction defines as any form of sexual expression accessed through the computer or the internet has increased dramatically over the past few years. And the cyber sex addiction is a serious harmful problem that can affect not only the addict, but also his family, spouse, friends, and employees. And cyber sex activities includes viewing, downloading, pornography along with the masturbation, reading and writing sexually explicit letters and stories, emailing to set up live sex meetings, placing personal ads to see sexual partners, visiting sexually oriented chat rooms. And the prevention of this cyber sex disorder is like the therapist should treat the disease similarly to other sex addictions. And initially, the addict needs to be helped to break through the denial that the problem exists and to recognize the impact of the behavior on the partner and family, and develop strategies for dealing with the sexual urges. And couples therapy suggested for some basic steps to help recovering cyber addicts enhance their marriages and other committed relationships. And cyber relation disorder. This is the internet can be a great place to interact socially, meet new people, and even start romantic relationships. However, online relationships can often be more intense than those in real life. And this is a fantasy-driven relationship that may negatively impact real-life relationships. It highlights the prevalence of deception in online profiles and the emotional consequences when online person is done match reality. It emphasizes the time spent online as a key indicator of addiction. And the internet addiction is characterized as an impulse control disorder involving excessive internet use to substitute for real life interactions. Warning signs includes preoccupation, unsuccessful patterns, attempts to cut back, and using the internet to escape from problems. And strategies for overcoming internet addiction includes limiting use of work and seeking professional help and developing coping skills. And the tips to overcome the internet addiction is place a limitation on the location that you will see the computer, and look for social support, and keep a computer diary and get outside help. These are the tips for overcoming the internet addiction. And the next point is the computer game addiction. Computer game addiction leading to the negative consequences in various aspects of life. It identifies causes such as stresses, depression, inactivity, and boredom. Types of computer addiction includes programming and general computer addictions. And cyberbullying. Cyberbullying is defined as harassment via technology, such as fake profiles and threatening messages. And preventing cyberbullying includes schools and colleges needs to make students more aware of the effects by cyberbullying, and parents need to monitor kids' internet and cell phones activity, and legislation needs to take action to deal bullies. And the summary of this unit focuses on childhood psychiatric disorders like ADHD, conduct disorder, childhood depression, and eating disorder and cyber disorders. It emphasizes the importance of early intervention as untreated issues can escalate into more severe problems in adulthood. And the factors contributing to these disorders include genetics and environment, as well as the treatment modalities like therapy and medication. And the psychologist plays a crucial role in assessment, diagnosis, and intervention, and collaborating with other professionals to provide comprehensive care for the affected children and adolescents. Thank you. Students, any doubts or clarifications you are having related to these units? Comprehensive approaches to psychological disorders and disintegrative disorders, which have covered more points in disintegrative disorders like ADHD, conduct disorder, childhood depression, cyber disorders. Students, am I audible? So tomorrow we are going to cover the substance abuse disorders and mental retardation, that is intellectual disability. Thank you.
Yeah.
Few more minutes are left so that we can discuss about the childhood depression. So some of the points we haven't covered, like childhood depression, manifestation of childhood depression, the progression of childhood depression across different stages of groups, highlighting specific signs and symptoms characteristics of each stage. And the diagnosis and the clinical features are like child who has had several years of difficulties with hyperactivity, separation anxiety, and intermittent depressive symptoms. And a major depressive episode in child is likely to be manifested by somatic complaints, psychomotor agitation, and mood cognitive hallucinations. And the child are likely to have secondary complications such as conduct disorder or alcohol and other substance abuse. And the antisocial behavior are like school performance is invariably affected by the combination of difficulty, concentration, lack of interest and motivation, fatigue, sleeplessness, slower thinking, and preoccupation. And the causes of these childhood depression, children may become depressed for various reasons. In many depressed children, there is a genetic predisposition towards a condition, which is then precipitated by stressful situations. And the social factors determine, such as loss of parental detachment, separation, divorce, death, academic failure, family conflicts, abuse, and neglect. And the social economic status are identified as a common precipitating factors for childhood depression. And the interventions are like pharmacotherapy, which can be used for childhood depression if the child is in a severe condition. And the parental and family therapy is very essential because the parents are the only members which are very helpful to the child. And the treatment adherence will be followed by the family and parents. And we have to give the therapy to parents and family because they are close to the child. And cognitive behavioral strategies may have the greatest efficacy. Okay, students, we have covered this eating disorder. Am I audible? Okay, students, thank you. If you are not having any doubts or clarifications, so that we can take a leave. Thank you. Thank you, one and all.